Welcome to the Doctors Barry and Bobby Rare Book Reading Room at the New York Academy of Medicine Library. I'm Arlene, the Historical Collections Librarian here. And today I'll be sharing some of the special things from our collection with you in a virtual visit. In 1933, the New York Academy of Medicine's Committee on Public Health published a study of maternal mortality in New York City between 1930 and 1932. That study was the beginning of a long-standing interest in this problem in the city and generated many more reports that have been published by the Academy. In today's virtual visit, we're going to be looking a little bit at the original maternal mortality report, but then we're going to look at some other materials that were published around the same time that were meant for the general public to help people understand more about the process of birth and delivery and to educate people in their relationships with doctors and other professionals who could help them have a successful birth outcome. And then finally, we'll look at the Birth Atlas, which was a collaboration between Robert Latu Dickinson and Abram Belsky to create a set of terracotta models that were displayed at the 1939 New York World's Fair. The New York Academy of Medicine's Committee on Public Relations first got interested in the issue of maternal mortality in New York City back in 1917. But it took more than a decade for them to publish a report about maternal outcomes in the city between 1930 and 1932. When the study was published, its findings were contentious. One of the things that the committee reported was that for many women, it was safer to give birth outside of a hospital setting with midwives in the way that they had been giving birth for a very, very long time. That finding was challenging for the New York Obstetrical Society, and the New York Academy of Medicine and the Obstetrical Society met together to try to come to a resolution, which they finally did. This report was the beginning of a long-standing interest in maternal mortality here at the Academy of Medicine. We have continued to publish reports about this intractable problem here in the city. For many, many decades, we're especially concerned about the problems of maternal outcomes, especially for women of color here in the city. And our reports aim to try to remedy those problems and see if we can move forward to a moment of more equitable and successful outcomes.